Hey everyone, welcome back to Giggles and Glutes. Today we've got a very special guest, Monique Koopman, a pelvic floor therapist, here to give us expert insights into pelvic floor health.
Hi, everyone.
As you know, we're all about empowering women through fitness and confidence, and we wanted to dive deeper into how the pelvic floor plays a crucial role, especially during pregnancy and postpartum. This topic doesn't get nearly enough attention. That's why we're excited to bring this conversation to you. When I saw on Facebook that Monique was a pelvic floor therapist, it was super exciting to know someone close to me where I could pick her brain. If you haven't already checked out our last episode on pregnancy and fitness, I will link that down below for you to watch after. All right, let's get into it. Monique, welcome to the show. Can you tell us a little bit about yourself and what exactly a pelvic floor therapist does?
Sure. So I'm Monique Koopman, a pelvic floor physiotherapist. I work primarily in private practice, but I also run a uterogynec physio clinic out at Tygerberg Hospital. I am president-elect for the Physio Society of South Africa. I'm also serve on the executive board of the Sexual Health Association of South Africa. I'm currently a very busy individual. Obviously, women is my passion. I have such a heart for women and the health of women, and that's what my daily strive is. It's to better the lives of women. And most of the things that I work in are very taboo subjects. No one wants to talk about their vaginas. No one wants to speak about their anuses. So this is why I do the things that I do. I love debunking all the myths that people have.
And that's exactly what we want to do on this podcast. We want to make sure that we are providing information for women that can empower them.
Thank you so much for making time for us. We really appreciate it.
Pleasure.
Okay, getting straight into things. My first question for you today is, how does pregnancy affect the pelvic floor, and what are the best ways to strengthen it before and after birth?
Perfect. In the true physio form, I thought my little pelvis work.
Oh,
So
I love that.
I thought that let's just go into a little bit about what the pelvic floor is. I think recently people have gotten a little bit more knowledge about what the pelvic floor is, but I thought let's show people practically what the pelvic floor is. So this is what our pelvis looks like. So your pelvic floor comes from your buttocks and it attaches all the way to the front to your pubic bone. And the purpose of our pelvic floor is twofold. So firstly, it helps to support these organs. So we have your bowels, uterus, and then our trusty bladder that sits right in front over there. So the pelvic floor helps, along with all the connective tissue and all the ligaments and everything, to support those organs up where they need to be. Something that might be familiar is a prolapse. So usually when we have a prolapse is that we have laxity of either the pelvic floor or of the connective tissues, and that's when we have a prolapse of the bowels or of the bladder. The pelvic floor, as you can see around here, also goes around the anus, around the vagina, as well as the uterine pipe. When we have a weaker pelvic floor, what can happen is that we have difficulty closing down the stream of urine or difficulty closing down the anus as well. Like any other muscle, the pelvic floor can be tight, and when it's tight, it usually refers to pain. So we can have defecation problems, constipation, difficulty passing stool, because we have a pelvic floor that is really holding tight. We can have sexual dysfunction, so sex can become really painful, and we also have bladder issues. If we have a weaker muscles are not strong enough, so we know that we're not going to have enough energy or action potential of that muscle to clamp down on our anus and our vagina. So when we're looking at where the baby would grow, so the baby would grow on this pelvic floor. It supports that uterus. Once we have something heavy on something that's quite elastic, we're going to have a stretching out of that tissue. So it's not uncommon post having a baby to have a little bit of laxity within this pelvic floor. So usually things do migrate a little bit down, and they do then give a little bit of more pressure. Usually that is quite quickly we recovered by our hormonal state or when we return to our pre-baby weight, hopefully. And that usually then recovers quite quickly. The predisposing factors to having long-term pelvic floor issues would be having more than 2 pregnancies, we say, usually predisposes that lady to having a pelvic floor dysfunction, or if she'd had a big baby or a difficult, prolonged third phase of the labor. So when that baby's head is engaged within this pelvis, if that phase of the labor was very long, that's also going to stretch out. And then also we find that if you've had a tear or an episiotomy, or you've had to have a vacuum-assisted or forceps-assisted delivery, that also causes trauma into this area, into that pelvic floor. So if rehab doesn't happen, then that always predisposes you to having issues with the pelvic floor as well. What happens with the pelvic floor during pregnancy?
Wow.
That's crazy.
That is, I don't think like a lot of people are actually aware of all the changes. Like they know I'm going to the bathroom more frequently, but they don't really know why. And then some people also have this issue where they're not able to regain, like you said, that strength or the elasticity remains. So then they're like, my bladder is gone weak. I'm not sure why this is happening. So I think it's also important from educating women because half of us don't really know what's happening in our body. It's like, say everyone's going through this thing, so it's normal, and we leave it at that, I guess.
Quite a lot of actually is that we normalize this. The amount of ladies that I see that say, "Oh, you had a baby, it's normal." "Oh, I'm old, it's normal." We sort of normalize bladder issues. We all know someone in our family who probably runs a lot to the bathroom, and then we all say, "No, it's fine. She's old or she had many babies." My biggest passion is debunking that. It's not normal. It is something that can be done to change it.
Yeah, and people forget the pelvic floor is a muscle and that it can be strengthened again, even if it experienced trauma and it's gone through weakness. So rehab is always an option in most cases, and if not, then I'm assuming surgical help would then be necessary. But it's not a problem that you have to live with if after you experience certain symptoms.
100%. If you had torn your bicep muscle, you would have gone for rehab. It's so shocking to me. And it speaks to our culture and conservativeness of most of us is that we're scared to lay on a bed and have our vaginas examined. It just speaks to that. And also, as women, we prioritize so many other things and other people's things that we don't take the time to actually prioritize our own well-being. If we're looking at international standards, America's as well as most of Europe, pelvic floor rehab or pelvic floor assessment before and after pregnancy forms part of normal postpartum care. But in countries like South Africa and most of Africa, actually, that field is still quite lacking. We still need to educate people. Go see the physio before you decide to fall pregnant. Let's see if there's anything that will predispose you to having these issues. And then also post-op, have an assessment before you start resuming sex, before you start resuming exercise. Go and see the pelvic floor physio so that there are some checks to make sure everything is in place.
Does this go beyond your general Kegels, would you say?
Yeah. So when we look at the pelvic floor, I like to start off with first just activating the pelvic floor. So I have a lot of ladies who come to me and say, you know what, I'm just going to get those vaginal cones, pop the vaginal cones in, and I'll be okay. Or I'll get the vaginal balls in, and I have a couple of gynaes who tell the ladies, oh, just go to the sex shop and get some of those balls. I don't like that. Firstly, we need to check the tone of that muscle. Is this patient sitting with a hypotoned pelvic floor, meaning we don't have much strength in that? And you guys are both personal trainers. You would never give away to someone who has less than a day 3 muscle strength. But exactly that same principle. We need to see, is that pelvic floor actually in a spasm? So what benefit would it then be for me to put a cone in there in an already contracted muscle? It's just going to exacerbate the issues. If we're looking at all the muscle attachment, abdominals attached in this area, we have glutes, we have multifidus, we have quite a lot of the other muscles. So it is a system, the whole system, and most importantly, the diaphragm. We always speak that the diaphragm is the roof of your core and the pelvic floor is the floor. And they have this wonderful relationship where they have to move together. And so if we have a pelvic floor which is moving down, but a diaphragm moving up, we increase that pressure in the system. That's going to predispose us to issues. So it's a really good pressure system as well. So it's just not pelvic floor. We teach on pelvic floor by activating it, and then we progress. So when we progress these pelvic floor exercises, we do it with movement, weights, activating the entire core, multifidus, abdomen, the abdominal muscles, and your diaphragm.
What would you say are the common signs of pelvic floor dysfunction in postpartum women, and how can exercise help in recovery?
Right. We have two different fields right now, or two different type of patients that would come and see me. Firstly, I have the lady who says, ever since I gave birth, I'm really struggling to keep my wee in. If I cough, sneeze, or laugh or jump, I'm leaking. That we call stress urinary incontinence. The basic thing of that is the pressure generated by my pelvic floor closure pressure at my urethra is too low compared to the intra-abdominal pressure. Or we have ladies who say, I have urgency. I no longer have the bladder capacities that I used to have. I find myself running to the toilet a lot more these days or waking up a lot at night. We will then assess to see, does this patient sit with a pelvic floor which is weak? Do we need targeted pelvic floor exercises for this patient that we can integrate into her normal daily life? The second patient that I would see could be a patient who experiences pelvic pain. And that pelvic pain can be pain with passing stool or pain with sex. So they've tried sex after the 6-week clear. We know people don't usually wait the 6 weeks, but we check that they are fine for that 6 weeks. And then they try and have sex, and then it's really painful. What we will then do is we will go and have a look and see what is the integrity of that muscle. Has the healing, if the patient had a tear or an episiotomy, has that recovered adequately? If the patient has a pelvic floor spasm, we are going to focus more on down training that pelvic floor, because remember that pelvic floor is always in a semi-contracted state. So then we will look at down training that pelvic floor, teaching that the patient to not keep that pelvic floor in that contracted state. So yes, it will be lots of down training. And then also, if we are having a patient who has an issue of closure, we are going to limit the amount of intra-abdominal pressure. So you're not going to then look at doing lots of sit-ups. You are not going to do lots of weight training that's going to increase intra-abdominal pressure, because right now your closure pressure at your urethra is not strong enough. While we're working on that closure pressure, as the closure pressure increases, we can then increase the amount of intra-abdominal pressure your pelvic floor can withstand.
That's really interesting. That helps me personally when training a pregnant client to know that if this person had a pelvic floor dysfunction, these are ways to modify the exercise.
Yes, definitely. Yeah. And being open with your clients and be like, hey, do you leak by any chance? Some they're not even aware of leaking. They will say, do you know what? When I'm done exercising, I do smell a bit of urine on my pants or on my panty. They're not even aware of it, but it's because of that pressure. So having this open conversation with clients and being like, hey, what happens when we're doing weights? What happens when we are doing an ab workout? Do you find that the panties smell wet? Do you smell urine on your clothes?
Yeah. I also think it's like able to have these conversations openly, because women don't. Again, if these topics are not often spoken about, it's a bit uncomfortable to ask questions. Like in a PT session, you're with a client who's maybe she's new and then fell pregnant. You don't have that relationship yet. So it might feel awkward, but thinking about it in the long run, it's beneficial. You have to ask uncomfortable questions, know how to
I always say
proceed.
it's uncomfortable because we make it uncomfortable. Like
Yeah.
sometimes they're wanting someone to talk about it.
Yeah.
Like I remember when I just started becoming a pelvic floor physio, I found it was inappropriate to ask an 80-year-old if she's still having sex. Now I openly ask, and the amount of stories they tell me, my gosh, I'm like,
I can only imagine.
I find that it's us, we make it weird. But
Yeah.
having a conversation and being like, hey, I know that you're a certain age. Like, I see that you've had 3 babies. How's that pelvic floor? Do you find when you cough or sneeze, there's a little bit of leak? And you'll be surprised that they'll say, oh, yeah, that's why I actually don't like Zumba, or that's why I actually don't like Taibo. There's actually too much jumping in that. That's why I stay away. So they quickly come up with the idea and say, okay, I don't do skipping ropes. Like when my kids are jumping on the trampoline, I'm not going on the trampoline because I'm always afraid to leave. Yeah, you live very quickly. How can I make this a conversation? How can I actually try and coax these things out of my patient without actually making it awkward? My vagina's all day. The vagina is not a bad word.
It's not a bad word. You have to like say 10 times to get over the fear.
How
I
long
also
after childbirth should women wait before starting pelvic floor exercises? How long would you recommend after giving birth?
Is 2 minutes too short? Immediately.
In Germany, that is exactly what happens. I gave birth, then after they stitched me up, I had to get on the toilet, made sure I weed, then I went up to my room. An hour after I was settled, a nurse came in, helping my feet on the bed, showing me what I can do. And that was like not even an hour after I've given birth. The next morning, I had a physio come to my room, showing me how to get out of bed, how to stand. The day after that, she took me to the stairs, taught me how to do the steps. On the third day, she came to my room, teaching me how to do exercises to strengthen my hips and pelvis. So, like you said earlier, pelvic floor health is huge, huge, huge. I'm only speaking for Germany at the moment. For women, they want to make sure you have no issue having another baby, basically.
Exactly.
Just as it should be. I remember you saying earlier it is cultural. For us, definitely it is. Like we always look at it like it's, oh, you want to be bougie, so you do this thing. This is generations of colored culture. It's not necessary. You soldier on, you push through, you just do it. If you change your view on it to actually give the time to understand why for your benefit, it's not labeled as bougie anymore. It becomes necessary, which is what people, especially our culture, should do.
100%. We are our worst enemies, but it comes because our parents thought they were martyrs. They had to give everything for us. We are taught to put ourselves behind. And yeah, I just want to give every lady listening to the podcast just the permission to look after yourself and put yourself as a priority.
Yes, that's what we advocate for every week.
If we're thinking about strength training, and that's a lot of what my ladies would come to me like, when can I start picking up weights again? Or when can I start gymming or doing a heat class, for instance? And the rule of thumb is if you've had a vaginal delivery, uncomplicated, not a lot of feeding, you could actually start going back as soon as 2 weeks, where you start doing gentle walking. You can start doing what your body allows. And I always say, you need to listen to your body. We all know the normal limits of workout. We are not going to push you to your pre-birth targets. However, if you had a C-section, we're always going to wait the 6 weeks. And the reason for that is we need that fascia and we need that wound to close. And the risk of having a hernia in that area to be a lot less. So that's important. And then we gradually work up to going back to strength training. So we do body weight first, and then we go back to strength training. And the reason for that is we know that after giving birth, we have this massive decline in estrogen levels. It's documented as the worst hormone storm that you could ever have. And that takes about 6 weeks to normalize. And remember, the pelvic floor loves estrogen. So when we are young, we have lots of estrogen. Just as how plump our faces are, that's how plump our vagina is. It's moisturized because it has enough estrogen.
Analogy so much.
Once we have this decline in estrogen, and a lot of ladies will tell you that first time having sex was not really comfortable because the vagina is dry, because we have this decline in estrogen, right? This is the time you're grabbing the lube because sex is just not that pleasant. So we have this decline, and we see this in our menopausal ladies as well. As the tissue becomes dry, the vagina becomes very dry as well. And then because the vagina is at risk, it doesn't have that plumpness. It's quite more elastic. We have a bigger risk of having a prolapse. So that's why we wait for the 6 weeks for weight training, right? In saying that, small weights, body weight is always going to be effective. We know that our estrogen receptors are built in muscle. So if we lose excessive muscle mass, we are going to have less estrogen receptors, more prone to hormonal issues. So that's one of the ways that we can actually naturally increase estrogen. I'm a recently converted weight trainer. I thought weights were not for females, but now I know nothing
Wow.
weight, and I'm such an advocate.
Welcome.
I hated myself in the first couple of weeks. It's like, is this my new life? This soreness, man, I'm over the soreness. Which is so joke.
You just left it, yeah.
I can live with it. My bum's always so it's fine. My arms are always it's fine. So I absolutely, and this comes obviously back to multiple research over the last 2 years, showing that forget, no, I shouldn't say this to you guys, forget cardio.
Say that to
You
us.
preach
We
this.
preach this. You should listen to our other episodes.
Oh, I should have.
We preach this.
This is what the studies are showing. Weight training is not only great just for building muscle, but it's great for longevity. It's great for
Yeah.
our menopausal ladies. It's great for our PCOS ladies, our polycystic ovarian syndrome ladies, just hormone ladies, to endo ladies. The weight training is brilliant at normalizing the estrogen levels. So if you've got any of those conditions or you're menopausal, premenopausal, these are the weight trainings we know is going to help because it's increasing that estrogen receptors. So yeah, my new line is weight training.
I love it. What would you say is the best alternative exercise for core engagement during training? Or would you say it's something more like connection breath that would be more important?
Definitely the connection breath, right? When we take a deep breath in, our diaphragm moves down to allow air into the lungs. We should then have pelvic floor move down
Movement.
as well as we take a deep breath in. So as we
Yes.
take a deep breath in, we should have this feeling. Then as we take a deep breath out, that diaphragm moves up. It's supposed to take pelvic floor along with it. So when we do pelvic floor exercises, and this is something that you can teach your clients even when doing weight training, is that when you are breathing out, engage that pelvic floor. And so that we are not getting this, so we're breathing out, but we're bearing down. So that's going to
Yeah.
increase pressure into that chamber, put more pressure onto that connective tissue and that organs, and cause laxity in that area.
Oh, wow. That's actually very interesting. A lot of people don't know how to breathe correctly. Like they're not really aware of how to breathe properly. You kind of have to teach and explain to them, and then it's, do you feel this? Do you feel that? What do you feel? And then it's, I don't know how to breathe. How am I alive?
Yeah. So people flint quite a lot here and they don't do the belly breaths. We keep really breathing quite a lot because we need that diaphragm to move down. If you're just splinting,
Yeah.
you're just breathing upper, you're going to have an issue. You are going to then have increased pressure, which we speak about. And so my first appointment is correcting breathing. That's a lot of what I do. And it's shocking that you can actually spend 30 minutes with a patient just trying to teach them how to breathe.
How to breathe.
Yeah, that is crazy. Guys, if you are enjoying this episode thus far, show us some love by hitting that like button, and then we're going to get right back into the episode.
How does this affect the mucus plug during pregnancy? Does it at all?
No, it shouldn't.
No.
The mucus,
Okay.
yeah. So the mucus plug is just in the cervix. So the only way that the mucus plug would come out is if that cervix is opening. That's hormonal and part of labor.
That's a good question. The misunderstood or seen as being linked together, but the one is activated purely by a hormone and the other is a muscle.
Alternatively, it could also be that you have a insufficient cervix, a cervix that's threatening to open up. And that would usually be ladies who are anyway on bed rest, and that your doctor will say to you, no, you can't. I'm going to stand very much corrected here, but I don't think that exercises is going to necessarily make you lose your mucus plug if you were not already in labor because your body was forcing labor, if that makes sense.
Okay. Sure.
How can women safely return to strength training or high impact exercise after childbirth while trying to protect their pelvic floor?
Find the nearest pelvic floor physio and have the assessment. When we see a postpartum mom, we always going to first have a look at the abdominal muscles to see if you have diastasis recti. So diastasis recti means that we have that separation of that abdominis. If we have that separation, we are going to be very cautious with you. We are going to try and not do quite a lot of intra-abdominal pressure. We'll actually say to you that strength training is going to be a little bit on a hold or slightly adjusted until we either get union of that rectus abdominis or until your doctor says that it's fine. And that is obviously anything that is going to cause intra-abdominal pressure or any sit-up motion or plank motion. So those are the things that we're going to first look at. Secondly, we then also going to have a look and see, is there anything in that pelvic floor, surgery including miscarriage, causing pelvic floor tightness? We think tight is good, but we all know that tight's not always great. We need to have good range of motion within that muscle. So we're going to then have a look and see, what is that muscle looking like? Is it very tight, holding on, going to give you issues? Is it that you have a weak pelvic floor with not enough of that closure pressure, and maybe we need to strengthen that? And then we are going to have a look at posture. So we know during pregnancy, we usually have an anterior pelvic tilt, which means that every those muscles are all going to be lengthened and back shortened. And so we're then going to also make sure that we're going to get that pelvis into a more neutral position so that we are not predisposing you to muscle injury when you do return to sport or return to weight training. And then we, most importantly, also have a look at your breathing. Breathing post-pregnancy can become quite a problem because obviously you've had this baby that was pushing up against the diaphragm. Most ladies after giving birth have a little bit of a paradoxal breathing pattern.
Yeah, and it almost feels like you can't connect with your pelvis. Even if you focus trying to squeeze or trying to connect, in my experience, it was like I was trying to do the breathing exercise to try and get the connection in the beginning. And it was like, this is not working. But obviously, you have to keep on, you know?
Exactly. And also, it's the same that we spoke about, that estrogen. So, obviously, if you've tried to do that exercise within that first 6 weeks, you're going to have, firstly, the pelvic floor has been stretched under the influence of that relaxin hormone, the hormone that helps to just open up everything during birth. So, it was under the influence of relaxin. So, this tissue had been already stretched far beyond its normal capacity. We have this stretching of that fibers, but also have the lack of estrogen, which is also going to give an issue.
What role does breathing and core engagement play in maintaining a strong and functional pelvic floor? Or what other things can you do to help rehab your pelvis after it has experienced trauma?
All right. So like we said to you, that diaphragm is the ceiling, the floor, and then we obviously have your abdominals and your back muscles, which is part of the core. So it wouldn't be very wise to just concentrate on pelvic floor, and then we still have the dysfunction above, and we have weaker abdominals, weaker back muscles. Having a combined treatment focusing on breathing with pelvic floor, abdominal movement with pelvic floor, and breathing. So it needs to be a combination movement. And because I know that physios are not the greatest exercise prescribers, although it's part of our job, we just don't. We're more hands on, actually. However, I always get a personal trainer or a bio on board, and I will tell the personal trainer or the bio to say, hey, this is what I found. Can you work on this with training the patient? The treatment techniques, we do quite a lot of abdominal work, especially fascia. It has got its flowers recently, which is great. So
Yes.
everybody's talking about fascia and the role that fascia plays in quite a lot of aspects in life. But when we talk about abdominal fascia, so the abdominal fascia connects literally over here. So when I have really tight abdominal fascia, it's going to also affect the way my pelvic floor is moving. We do quite a lot of abdominal fascia work, lots of skin rolling, breathing, teaching the patient, giving the patient skills as well to manipulate fascia at home. Core exercise, breathing exercises, pelvic floor treatments. So if my patient comes to me with a pelvic floor that is really tight and holding on for dear life, we can then, just like any other muscle, insert finger into the vagina, palpate that pelvic floor, and do a deep pressure to release the trigger points or my fascial points of tightness over there. And then also, I do dry needling of the pelvic floor. I know that sounds weird to people when I tell people, stick a needle in there. They're like, no and yes. So the needle, the dry needle, do you guys know those acupuncture needles? So the difference between acupuncture and dry needling is that acupuncture goes through, it's Chinese medicine, so you have this almost like meridians, I want to say, that you put it in, where pelvic floor, we're looking at a point of muscle tension or muscle tightness, and we're inserting it into that muscle. So it could obviously depend on what muscle of your pelvic floor is an issue, and we insert a needle into it, and it helps to dissipate that spasm. I've had amazing results with dry needling. I find that patients who are really struggling with a really tight pelvic floor, it's not letting go. Traditionally, before doing dry needling, we would maybe spend 4 or 5 sessions trying to down drain this pelvic floor, gone for dear life. And then with the needles, we're finding that muscle dissipates quite quickly. And the patients are then like, oh my gosh, is this what it's supposed to feel like not to have a pelvic floor which is constantly in? It's been amazing in my practice, especially if it's a patient who's traveling out of the city to come and see me. I find that the needles works really well for them because it then goes, they can use the relaxed state of that muscle, and they can now do their stretches and their breathing without having this pelvic floor holding on for dear life like that. We then will look at that scar tissue of that, if you had a tear or if you had stitches over there. We're going to then look at that integrity of that pelvic floor scar, and then also to try and manipulate it so that it can be in alignment, that we don't have adhesions or tension around there, because we know that if there's going to be tension over there, that action potential of that muscle is not going to be great, and we're going to have that a weaker muscle purely because of that healing that didn't take place that great over there. If we do have pelvic floor weakness, we try and teach the patient how to activate the pelvic floor in the right manner. People think that pelvic floor exercises would just be Kegels, and we know that when we're looking at the muscle fiber of the pelvic floor, it's made up of 2 different types of fibers. So 70% of the pelvic floor is made up of slow twitch, and we only have 30% that is made up of fast twitch. If we are concentrating on quick squeeze, quick squeeze, quick squeeze all the time, we are not going to be training that pelvic floor effectively. So what I do is we teach on activating the pelvic floor from the entire length, and I'm going to go through the way I would teach a patient coming into my rooms how to activate the pelvic. So usually I ask them to sit up and then also then just push their bum out a little, do a little bit of an anterior pelvic tilt. And that's just because then we can do a little bit of biofeedback on the surface that they are sitting on, that they know where they are working, right? Because the muscle runs from the coccyx to the anus, the direction of movement that we are focusing on is this way. So we always started by squeeze your anus as if you stop a wind. And then it would be important to correct that immediately, because when I say squeeze your anus as if you're stopping a wind, half of my patients go and squeeze their bum cheeks. We're not doing glutes, we're doing the anus. It's just, we're just trying to anus as if you're stopping a wind. You're going to hold the anus, but bring that feeling forward towards the vagina and squeeze your vagina as if you're stopping a wee. And then we hold that for 5 seconds. So we know that the pelvic floor muscles should fatigue at about 10 seconds. That's a gold standard. But if we then ask the patient, how long were you able to comfortably hold that contraction to? And if they say, I was able to hold it for 4 seconds, and I'd say, okay, let's maybe start the first 10 repetitions at about 3 seconds. Just like you would do with your training. You start off at a low weight and then start increasing it from there until they are able to do 10 repetitions with 10-second holds 5 times and 5 times a day. Then we know that we can progress then to having that weighted. So we can then put some cones or balls in. We can start adding movement to a squat while activating our pelvic floor. Let's try doing a lunge while we're doing our pelvic floor so that we can have body weight plus external weight that the pelvic floor has to move against. So and then afterwards we then do the quick contractions. And the quick contractions, that's what people traditionally know as Kegel exercises. That's going to be a quick squeeze, relax, and then we do 10 of that also 5 times a day. We also then say to patients, we're going to do from now onwards, it's going to be squeeze before you sneeze, or squeeze before any intra-abdominal pressure. So we can force that closure pressure. Eventually, the pelvic floor will become so strong that it will automatically squeeze when there is intra-abdominal pressure.
Teaching your brain to create mind to muscle communication.
What a crazy and insightful episode. That was so much valuable insights on strengthening and taking care of our pelvic floor muscles. And we just want to say thank you for your time, Monique. We are honored to have had you here. To our listeners, if you loved this episode, don't forget to subscribe for more expert tips and discussions like this.
Before we say goodbye, write to you if you were wondering where you could get a hold of Monique and how she could possibly help you. Monique, do you mind telling us where people could find you?
Oh, I have a practice out in Panorama, Cape Town, under Koopman and Coop physiotherapist, and the branch is Giggles Coop. And also online, you can search my name, and then on my Instagram page, it's Pelvic Floor Physio by Monique. Yeah.
Thank you so
Awesome.
much.
It's a pleasure.
See you next
Thank
time.
Next time. Bye.
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 Bye.